Welcome. I'm at West Edmonton Chiropractic Studio. I'm Dr. WendyCoburn. I'm going to show you some of the things we do for a well baby checkup. We do well baby checkups to make sure their brain and their body are working together so they are healthy, their body is functioning and healing. Birth can be really stressful on the body, and we want to make sure there's no interference. So come on in, we're going to go over some of the things we look for. Some of them your medical doctor, pediatrician are going to look for. We want to look at their color. We want to look at the symmetry of their face. We're going to be looking at how they can open and close their mouth. We're going to look at reflexes, getting them turning their head left and right. We're also going to move down and look at their hips, if their hips are moving the way that they should. Also, we're going to do some traction, light traction, just to make sure they actually can relax their hips and they're not stuck in flexion like this and they're not fighting. I'm going to check their Babinski sign. That should be there from 6 to 9 months. We're also going to check and make sure that they can move their arms up above their head, how easy or hard that is. If it's hard, that gives us an indication there might be some interference or something not moving right in their upper back or even in their neck. So we want to make sure that there's motion. We're also going to check the collarbones in there. Normally we have them just in their diaper, so we will check the reflexes on their tummy as well. We're going to check for the color. We're going to look for any birthmarks, changes in their skin. Again, just lightly going, checking all the sutures of their skull, making sure their fontanelle is open, making sure there's no tension in any of the sutures of the bones of the skull that can impact how they're latching, their sinuses, their vision. And then when we've got all that, everything looks clear, we're going to flip them over on their tummy because we want to actually see for a moment first when they're on their tummy. Are they able to lift and move their head left and right? Can they make changes? Even when they're only a few days old, they should be able to have a natural normal reflex to create some shifts, and some babies will already be able to do a tiny bit of extension. If we have a baby coming in that's 5 or 6 months that can't even do any extension and they hate tummy time or even 2 months, that's an indicator to us that they could use some chiropractic or they may have some interference. We're going to look at how their ankles come up to their bum, that they can flex. We want even wrinkles, making sure their hips are healthy. We're going to squeeze their bum to make sure their crease lines are even. We're also going to check up around the base of the head that there's no trigger points or any tension up and through here. Feel the tone of the spine, making sure they're not laying in a C-curve position, be it on their tummy or their back. We're also going to check, before we even start feeling for motion in their spine, we're going to check the temperature of their back. It should be the same all the way along. We're going to look at the lower back, the mid-back, the CT, the base of the skull, and see if there's any variations, because that's also an indication of interference. And last but not least, we go along the spine. Their vertebrae are so tiny and still forming. Light pressure, the pressure you put on your eyeball, just to make sure everything's moving the way that it should. If there's more to the exam, that's where we're going to finish today, and we'll share more with you next time. Thanks.